Hi, this is Dave Covell, Health Commissioner here at Lorain County Public Health. I wanted to talk a little bit today about what we've been doing behind the scenes regarding COVID-19 and a little bit of why we're doing what we're doing. So I think it's really important to go back in history a little bit to talk a little bit about what is going on and why we're doing it. In 1918, the flu pandemic really overwhelmed this country and the world, and even here in Lorain County, our medical system, and it became a problem because we did not have the capacity to keep up with it. And so one of the big concerns we have is to make sure that people don't have to die unnecessarily because our medical system can't keep up. The other example of this might be in World War II, where churches and other buildings were taken over as hospitals because, again, there were just way too many people who were injured and had a problem, in terms of being wounded in the war, and there was just no way that the hospitals could keep up. And again, the idea is for us to develop a system and to slow this virus down so that it doesn't happen to our medical system now. And even if you think about it today and what happened in Italy, it's really important to remember that we can learn from that lesson right away. Italy actually was overwhelmed a little bit when it started spreading in their country faster than they were ready for. And so it overwhelmed quite a bit, and quite a few people died because they did not have the capacity to keep up. And so learning that lesson is really what is going on here in the United States and in the state of Ohio and here in Lorain County to really try to prepare and slow the virus down so it doesn't overwhelm us, and to prepare for when the day hits when there's a large amount of cases. So let's talk about this. How would we get overwhelmed? So here's some statistics from back in 2016 and 17 when you think about seasonal flu. So there's about 20 million cases of seasonal flu that season and about half a million hospitalizations and 38,000 deaths. So you think, well, seasonal flu, that's a lot. But remember, this occurred over a flu season, which is between 6 and 8 months, sometime from September to April in this country. As of April 5th, we already have 304,000 cases and over 7,000 deaths. And that number keeps going up every day. And that's only really started to hit in this country since mid-March. So you can imagine how quickly we could get overwhelmed if this moves that fast through the country. So every day around 2 o'clock, we post our total confirmed cases and the amount of those cases that have recovered and the age range, and then, of course, unfortunately, the people who have died. And the other piece that we talk a little bit about on our website is the total contacts that have been quarantined, and then how many of those are still in quarantine and being monitored, and then how many have been released from quarantine. So let's talk about the incident command system. So one of the other problems we have when you're in public health is this is 24/7. With 7 days a week, we're working on this. And so what can happen is your staff can get overwhelmed. And so we've developed an incident command system so that we can divide and conquer. We can actually have people that come in and out of the incident command so that they can get a break. And so we have a week-long structure. So it goes from Tuesday to Tuesday, where we have people filling those roles inside Incident Command. And then the following week, they can get a break so that, again, we don't burn out. Because, again, this is a marathon, not a sprint. So one of the big pieces of Incident Command and one of the big pieces of what we're doing every day is answering calls. And so this graph illustrates how many calls we've been getting. And early on in the process, we were getting calls from the worried well that were asking, what should I do if I start feeling sick? When should I get tested? When should I talk to my doctor? And a variety of other things. And so those were the early calls. And then when we had the schools closed and the stay-at-home order, we began to get calls regarding is this an essential business? Is it not an essential business? What are we doing about essential businesses or people that aren't essential that are staying open? And so a lot of those calls we've been handling recently. Of course, one of the big pieces is trying to get the message out. Unfortunately, it's difficult sometimes because the media is 24/7 on this. Every day, the media is doing multiple stories on this. And so how do we make sure that the right message is getting through? So part of what we're doing is communicating with our partners. And so we have school superintendent meetings, city officials, businesses, faith leaders, mental health, and first responders. And we have regular calls to kind of keep them up to speed on what's going on. We also do interviews in the media. Some of those interviews are very easy to do because we're really handling the very basic message of cover your cough, wash your hands, and stay home. Some of them are more complicated, and so we try to answer people's questions because, again, there's a lot of worried people out there about how this virus spreads. We've also done some videos for our website. We do some work in social media. It's really important for us to keep trying to get the message out and get people to really understand where to get the accurate information. Let's go back to our cases. If we think about what our case graph looks like right now, you can see that we have new cases every day, and we have how many existing cases are still out there, how many people have recovered, and then unfortunately how many deaths. And so as this graph moves, we'd love to see this flatten out and all of a sudden start coming down again, but we know that this is the very beginning of this graph. And unfortunately, this graph's going to get larger over time. So we're doing what we can do to try to stop that. I want to talk a little bit now about what contact tracing looks like and give an explanation of some of the work that we're doing with our EPI team to try to make sure that we can slow this virus down. When we get a call for a positive case here in Lorain County, we actually have a team that contacts that person confirmed with COVID-19. As they contact them, they identify close contacts that may have been exposed to COVID-19. Then those contacts are followed for 14 days. They're quarantined, and then we check on them over a 14-day period. And during that time, we try to determine whether they develop symptoms. The key with people who are not symptomatic during that 14-day period is that they are released from quarantine. Folks who do develop symptoms are tested, and then we determine whether or not they become a case. I want to now talk a little bit about what would it look like if we had uncontrolled COVID-19 spread in the community. So this graphic kind of talks a little bit about the initial case is developed in the community. Then those cases begin to spread based on community members, friends, family, and again, interactions in the community. As it moves through the community, it can move into a business. And when it moves into that business, then it spreads to other people who live in the community who actually work at that business also. With uncontrolled spread, it doesn't take long before the virus is everywhere. So now how does what Lorain County Public Health does around contact tracing slow the spread of COVID-19 in the community? So we get the first case and the second case, and then we identify contacts. And we start to isolate those folks and quarantine those folks. And then we identify businesses that it may be. We identify other areas, and with our isolation and quarantine efforts, we can actually make sure the spread is a lot less. It's important to remember we'll never stop the spread, but we can slow it down. So that's some of the work that we've been doing here in Lorain County. And remember that local health departments all over the state and all over the country are doing this similar kind of thing to try to slow this virus down and try to protect our health system from being overrun so that when people do get sick, we can actually help them get better. And we're really working on this 24/7. And again, I think it's important for all of us to make sure we do our part. Stay home, stay socially isolated, cover your cough, wash your hands. It's really important for us to try to slow this virus down. If you need good information, social media is not the place to get it. Social media is a great place to get funny stories to keep us laughing a little bit, or inspirational stories about how we're helping our neighbors. Those are all great things. But if you want good quality information, go to loraincountyhealth.com or call 440-322-6367. Thanks.